Hi everyone, we're back, and today the topic is the new nurse. Do you know your heart? Well, let's talk a little about the basics of the heart. The heart is quite a complicated organ, but let's start. The brain is more complicated than the heart, but let's try to give you the basics. Each heart has 4 chambers, and there are 2 upper chambers and 2 lower chambers. We know there are 2 atria, those are the upper chambers, and 2 lower ones, the 2 ventricles. And each heart has 4 valves. They work to prevent backflow of blood as it's pumped through the heart. There are 2 atrioventricular valves, which are called the mitral and tricuspid, and there are 2 semilunar valves, the aortic and the pulmonic. There is also another system of the heart which is called the electrical conduction system of the heart, and that is the one that influences EKG reading, the electrocardiogram. So let's discuss a little further what exactly that is. The electrical conduction system of the heart. The sinoatrial node, as you see here in the upper left portion of the heart, is the pacemaker of the heart. It actually is in the left atria. I take that back, the right atria. And it begins, the SA node continues, the impulse from the SA node goes into the atrioventricular node known as the AV node. If the SA node is unable to perform its normal function because of heart damage, the atrial node usually attempts to take over, but it cannot beat as fast as the sinoatrial node. Now, hemodynamics, when we talk about that, we're referring to blood flow. Blood is pumped around the heart. And what happens when the heart is damaged, it's not able to do its job competently. And this is referred to when we have damage to different areas of the heart. We call a heart attack a myocardial infarction. And it affects cardiac output. If you have a damaged heart, you're not going to get a full cardiac output. So the heart problems are usually treated, an EKG is usually done as part of a workup when a patient goes into the hospital. And usually after the doctor reads the EKG, the nurse can read it too, but the doctor decides a course of treatment based on what he sees, where they progress from there. There's just all different types of treatment. Sometimes they may have to give that TPA, sometimes they may not get that far. That depends on what the situation is. Now let's talk a little about the blood supply of the heart. The heart has the main one is the left anterior descending, and that is the one which supplies blood to the left ventricle, which is where you get your pumping power, which if it's damaged, usually the heart is not able to pump blood out of the heart, so it backs up into the lungs, resulting in conditions like congestive heart failure. Then we have the inferior wall of the heart, the right coronary artery on the inferior wall, and that's where you get, as the heart rests on the diaphragm. When patients have a heart attack, they often complain of indigestion in that area because it's the inferior wall of the heart which rests on the diaphragm. I'm not going to go into too much detail of this. You can take the time to read about it, and it's easier to learn that way. It's so involving. But I am going to reference you to what is called chest pain assessment. It cannot be avoided. Too many people come into the ER complaining of chest pain for one reason or another. It might be stress related, but it may be more than stress. Here is Jim and his wife. They're just enjoying a lunch outside at a cafe. Suddenly, he starts complaining he's having chest discomfort. They call 911 and the paramedics are called. He's taken to the emergency room. Here in the emergency room, he's assessed for his chest pain, and there are other interventions that are done. He has his vital signs taken, oxygen saturation, EKG lab values, and as Jim is assessed, there are other things that are done. The paramedics usually give these patients, because this is protocol from American Heart, drugs like aspirin, morphine, if depending on the situation, the assessment, nitroglycerin. These are guidelines of American Heart, of course. It's called mono. They give them oxygen, morphine, oxygen, nitroglycerin, and aspirin. I hope you've benefited from this, even though it's very quick. Have a great day.